Hi, my name's Jenny Hancock. I'm the Place and Community Director for the Howard de Walden Estate. The Howard de Walden Estate is a historic landowner in London. We own 92 acres, central London, in the Marylebone area, and within that we have over 1.7 million square feet of medical space. We have 5 different sectors actually: retail, office, residential, education and medical, but we're here to talk about the medical. About 6 years ago we decided to set up a collective called Harley Street Medical Area, which basically brought together all of our clinics, hospitals, operators to work as a collective so that on a global platform they could promote themselves as a concentration of medical expertise. Each then individually can continue to operate and market themselves separately. They're all obviously, a number of them, in competition, but actually collectively they provide, I think, the most concentrated centre of medical excellence anywhere in the world, and they're right in the centre of London. So it's a brilliant location and unrivaled expertise, all the way down to the expert who just concentrates on this part of the finger, heart expertise, etc., etc. And we help to facilitate this collective working together and promoting itself. We also look at the different buildings that we have. We're constantly assessing, have we got the right mix of tenants? Are there things that we're missing? For example, recently we've started the build of a proton beam therapy unit. It'll be the first in the world that's a linear accelerator. That requires finding a building to do the project in, finding the right tenant with the right expertise to operate it. This is the kind of thing that we do as a landlord to ensure that the expertise is right and functioning, up to date. Things change all the time. Healthcare changes all the time. We're probably entering the next 10 years of the most interesting phase of healthcare, because it's going to be quite different to what we've seen in the past. In our area, primarily is private healthcare, but what you'll see is a number of our private healthcare, they have their outpatient unit here and they have their NHS element elsewhere in London or elsewhere in the UK. As I said before, it's a concentration of expertise, medical expertise, collegiate system, they all work together, and what you see is that the expertise that is here can be quite usefully exported to other countries. One good example for us would be Moorfields. They have their private outpatient unit in Upper Wimpole Street. They have their main NHS hospital and another private wing over in Old Street, and some years ago they exported that model to Dubai and are now operating a Moorfields unit out in Dubai, helping patients in the Middle East. I think that's probably the best example of something relative to this area.